Welcome back to the show. Well, a lot of students heading back into the classroom. If not this week, it's going to be soon. And certainly this is, I think, causing a lot of excitement and anxiety, which I think is normal for families. And that is why we are so happy to get some advice this morning, some reassurance from pediatrician Dr. Hernandez from Advent Health this morning, who is a mom herself with young kids as well. Doctor, good morning. Thank you for joining us.
Good morning, ma'am. Thank you for the invitation.
So again, I know kids very excited, however school looks like for them this year. I know kids, for the most part, they do love to learn. We want to make sure that teachers are doing it as safely as they can, as families are. What is your advice as students get ready to head back into the classroom?
My advice and my recommendations are like follow the CDC guidelines, okay? Which are wear a mask, wash your hands very often. If you're going to cough or you're going to sneeze, use a tissues and then throw away. Keep a social distance. And if you feel sick, you're not feeling good, just keep your children at home and call your pediatrician for further evaluation.
So yeah, let's talk about that, because I do think that's very important. Obviously, that's always been the message, right? If you think your kids are sick, keep them home. But now more important than ever, what things should we be looking for? Because I feel like symptoms for COVID have been all over the place. What say you, doctor?
Yes, ma'am. COVID, they can present different way. Sometimes I have patients that they have this kind of upper respiratory symptoms like fever, cough, stuffy nose, runny nose, or sore throat. But also we have seen children like the only way that they present could be like vomiting, diarrhea. Sometimes they don't have the taste, they lost the smell or the taste, or the smell or the taste of the food. Also, sometimes some patients, they complain about muscle pain, like leg pain, or sometimes headaches.
Yeah. So again, that's a lot of different systems or symptoms. Is the best, I mean, if any of those present themselves, I mean, I know we were talking about allergy season is right here as we approach fall. Any advice and making sure that we kind of know what we're dealing with, or is it again, just be safe to just be extra cautious?
I would say be extra cautious, okay? And if you have one of those symptoms, maybe you can keep your child at home at least for one day to see how they are doing. And if the symptoms getting worse, like I said, call the pediatrician so they can give you a little more for their evaluation.
Well, and I'm glad you said that too, because let's say a symptom does show and red flags go up and you go, okay, we need to have something done about this. What is that first phone call you make to your pediatrician? Of course, we're going to be talking about testing soon or as well. Is that where you would go to even get a test, the pediatrician?
Well, that is depend of each pediatrician, okay? But I will say the first phone call that you should do is call your pediatrician, okay? In our clinic, usually we talk first with our patients, and we're doing a lot of virtual visits. And in case that we think that this patient have the COVID symptoms, we can order those tests. And when we order those tests, we just tell them, let me know what laboratory usually you go, and we can fax the order so you can go and do the test. In the meantime, I would recommend until you get the results, stay home until you have the results.
Again,
and if it's negative or positive, then we decided for when you can go back to school or when you can go back to work.
Yeah. Little less than a minute left. We've been talking about physical health. Mental health, I think, is also just as important, especially for kids, which you're hearing a lot about these days. Any advice for helping kind of ease the anxiety for children?
Yes, I would say the best thing is have a good communications, a good communication with, especially with the little ones, because they don't know what is going on. I will say, just talk with them, try to explain in a simple way, like there is a virus, there is a germ, there is a bobo that is on the air, and this kind of virus is making sick a lot of people, and sometimes those people have to go to the hospital or have to stay home. That is why they have to wear this mask and wash their hands.
All right, Doctor. Well, as we have just a couple seconds left, what's your take home again for families as we just start this new normal, as so many of us going back to school?
Yeah, I will recommend be safe. Okay, just continue with your normal life, but with a lot of precautions. If you go out, please, please, please wear your mask and wash your hands. Keep your distance. And if, of course, if you feel sick, stay home. And like I said, call your pediatrician.
Well, we've been showing the website here. Again, we're so happy that Advent Health is a part of our team where we get to check in with you and your team a lot. Keep us up to date on the latest medical health news as well. Again, there's the website. There's the number. Doctor, we hope you and your family have a wonderful and healthy and safe back to school season as well.
Thank you, man. You too. And thank you for the invitation.
All right. And again, we'll make sure all of that goes on our website as well.